Good morning, good morning. I'm Dr. Jyoti Patel. Welcome to my Facebook Live this morning. I'm going to be tackling an important topic, diabetes. As you know, there's over 100 million people in the United States that are diagnosed with diabetes. 1 in 4 people have diabetes in this country. So the reason why I'm bringing this up today is because it's an important topic not just for adults, but we're also seeing a growing population of children that are developing diabetes. And so if you have diabetes or you know someone who has diabetes, please share this information, pay it forward, let people know what they can do to take back control of their lives. So my topics today are going to talk about what diabetes is. Hi, Purnimati, good morning. What it is, how you can diagnose diabetes, and then what can you do to help reverse or prevent diabetes if it runs in your family or you yourself are worried about it or already have it. Okay, so thanks for joining me this morning, and along the way, please make comments or ask questions. Good morning, Susan. Good morning, Karen. Thank you for joining me. Make comments, ask questions, because that's my favorite part of the talk. And if you don't know me, I'm Dr. Jyoti Patel, and I'm board certified in internal medicine, pediatrics, and integrative medicine. So that's, my specialty is diabetes as well, since I see that in my clinic a lot. So let's get started. What is diabetes? Well, in the medical term of things, when you come into the doctor's office, you might have symptoms that make you concerned that you have diabetes. But just remember, 1/4 of people that have diabetes don't know they have diabetes and have no symptoms. So just not having symptoms doesn't get you off the hook. Please still go in to see your doctor, establish a relationship, and get into the pattern of routinely screening for diabetes. So if you have symptoms, you're thirsty all the time, you're hungry all the time, you're urinating all the time, you're tired, you're losing weight, or you have vision changes, it's blurred, or you have brain fog, things aren't working right when you try to process or think, you may want to get checked out for diabetes. When you go to the doctor, what are you going to ask for? You're going to get a fasting blood sugar. And what are you looking for with your fasting blood sugar? It should be less than 100. Okay, that's normal, guys. I know we've gotten used to over 100, 110, 115. We give ourselves allowances and say, it's not really diabetes yet. I'm okay. But remember, the process starts 10 to 15 years before diabetes sets in. So if you have a number over 100 that's fasting, listen in, because you're going to have to start to work on it now, okay? If your number is over 126, equal or over to 126, then you're diabetic. So this is not good, okay? Now, your doctor may also order another test. It's called a hemoglobin A1C. That's your blood sugar for the last 3 months. So if you try to cheat on your test and do really good right before you went to get your blood drawn, you can't cheat on your A1C. That's an average of the last 3 months. Normal is less than 5.5, okay? So if you have an A1C of over 6.5, you're diabetic. If you're between 5.5 and 6.5, you're still playing with fire. So this is the time to listen in and try to reverse this condition called diabetes, okay? You may also do something called a glucose tolerance test. So people ask about that because pregnant women often have to do this glucose tolerance test to look for diabetes. They have you drink a sugar load, and they check your sugar 2 hours after. If your blood sugar is over 200, that's a problem, okay? You may have gestational diabetes, or if you're not pregnant, it's just diabetes. Now, if you check your sugar randomly, and you're having symptoms of thirst and urination and fatigue and blurred vision, and your random sugar is over 200 with symptoms, that can be diabetes too, okay? So checking your sugar is important. What else are you going to tell your doctor? Let's say your doctor just told you you have diabetes. What else should you be asking for? Get them to do a lipoprotein analysis. I talked about with the heart talk. Your lipids, your cholesterol, your triglycerides, your HDL, these are really important things to look at too. So make sure you get your lipoprotein analysis. There are some hormones that you might want to check. your insulin level, your adenopectin level, your leptin levels. You may want to check on some nutrients that might be making you diabetic, like low zinc or low D levels, vitamin D that is. You may want to check your B12 levels, omega-3 levels, right? So there's some other nutrients and vitamins that your doctor can check for you too, because you can use that to help fix the problem. Okay, so now you've been diagnosed with diabetes, you've had all your blood tests done, your doctor's told you to cut out sugar. How many of you think that eating too much sugar causes diabetes? See, that's the misnomer. Everyone that comes in thinks that sugar is the problem. Okay, so I'm going to take you through another analogy so that you can understand where diabetes comes from. And it's not just eating too much sugar, okay? Okay, you have a car. Imagine your car is sugar, and you're driving your car home. You get to your driveway, you click your garage door opener. That's insulin, okay? It signals the garage door to open. That's your cell receptor. So your cell receptor opens up, your garage door works properly, you drive your car into your garage. The same way, when sugar comes to the cell, insulin, which is your garage door opener, signals the cell wall, which is your garage door, to open. And if everything works perfectly, your car goes into the garage, okay? It's not the car's fault, it's not the sugar's fault that the garage door didn't open, okay? The problem actually lies in the garage door opener, which is your insulin, or in the garage door itself, the cell receptor. So I want you to remember that because that's important, and I'm going to take you through it a little bit further. So there are two kinds of diabetes. Good morning, Dorothy. There's type 1 and there's type 2, okay? In type 1 diabetics, which is less than 10% of all diabetics, which usually happens in young adults or children, you just don't have a garage door opener. Your pancreas stops making insulin. Maybe you had a genetic predisposition, you had a virus attack your system, your immune system goes awry, and you develop what's called an autoimmune condition, and it basically wipes out your beta cells in your pancreas, so you just don't make any insulin. So you're driving your car, you get to the driveway, you just don't have the garage door opener. So the cells can't take up the sugar. Type 1 diabetics become ketoacidotic. It can be a life-threatening illness. When they present, it's full-blown fatigue, brain fog, weight loss, eating a lot, drinking a lot, peeing a lot, and these patients need to be hospitalized. So we give them insulin through a drip or through injections to try to get the sugar into the cells. So it's a more serious condition, but 90% of us guys don't have type 1 diabetes. We have type 2, okay? So the reason why we have type 2 diabetes, and I'm going to talk you through that, is not the cars. You're eating sugar, which can contribute to having too many cars. So let's say you bought a lot of cars and you only have a 2-car garage. All those extra cars are going to be piling into your driveway, piling into the streets, right? So eating too much sugar can cause havoc in a different way. It piles up into the streets, which are your blood vessels. That extra sugar causes corrosion of the blood vessels. It causes inflammation of your organs. So what are some of the things that can happen with too much sugar in the bloodstream? Well, you can have atherosclerosis, which is plaque in the arteries. You can have high blood pressure from damage to the arteries. You can have blockages in your arteries leading to heart disease and stroke, right? You can lose your eyesight. You can lose your kidneys. You can lose sensation in your feet, destroys the nerves. For men, which is very important, guys, causes erectile dysfunction. Okay, so if that's not a reason to reverse your diabetes, I don't know what else is. Okay, so, and also it causes calluses and sores on the bottom of the feet that don't heal properly, and then of course leads to amputations. So having too many cars in the street can cause damage to the system. So we definitely want to make sure we only drive as many cars as we have garages, right? And we also want to make sure that the root cause, which is the garage door opener, which is your insulin, and the garage door, which is the receptor on the cell, is working properly. Okay, so what causes the garage door opener to not work? What causes the garage door not to open? It has to do with toxins, okay? Genes can play a role, but toxins. Toxins in our environment, toxins in our food, and toxins in our mind, okay? These three things are what I'm going to focus on today, so you can help reverse the damage to the cell receptor and the signal, the insulin, so that your cells can properly take up a lot of the sugar that you're eating. Okay, so toxins. So, well, let me talk about genes first. So people will say, my mom had diabetes, my dad had diabetes, it runs in my family. I'm just prone to it. This is just what's going to happen. Well, it's kind of like saying you have bullets in the gun, but it takes the environment to fire those bullets. So your lifestyle may have something to do with why that disease manifested. Let me give you an example. There are certain communities that have a higher predisposition for diabetes. Native Americans have a higher predisposition for diabetes. Way back when they had an active lifestyle, they ate from the earth, things were great, they didn't have the standard American diet, their condition was well managed. Now, with the westernization of diet and standard American diets, disease is more prevalent. And there's also a lot of other socioeconomic reasons for why it happens. The other community that is at increased risk for diabetes are the Asian populations. 50% of the global increase in diabetes comes from India, China, and Pakistan. So certain populations do have to be a lot more careful. So I do think that genes have something to do with it, and so these populations need to really pay attention. If your mom or dad had diabetes, listen in, okay? All right, so let's talk about, in addition to genetics, toxins. Toxins in our environment. How do they play a role? Well, think of these particular environmental toxins. The first one I want to tell you about is BPA. BPA, bisphenol A, is a toxin in our plastic products, right? So your water bottles, your soda bottles, your sports drink bottles. Plastic is also in the lining of cans. So if you're eating a lot of canned food, it's leaking into your food and it's causing damage to your insulin production. It's basically breaking your garage door openers. It's breaking the receptors on the cell surface so that the garage door opener can't get the signal. So these chemicals are actually physically toxic to your cells. So when you consume a lot of things in plastic, you have plastic ladles, you have plastic containers that you're storing your food in, you're heating up your food in plastic, you're eating TV dinners that are in plastic, you're serving your kids food in plastic. They're also getting exposed to BPA, which can then get into their systems and cause dysregulation of that hormone signal. Okay, that's the root cause. It's not the sugar that's the problem. It's the not getting the sugar in the cells. So I really want that message to get across. So get rid of your plastic. I did a video on plastic before, so look at it. Look at the bottom of your plastic containers. It has a little recycle triangle. Look at that number inside that recycle triangle. 4 and 7, that's BPA. So get rid of your 4s and your 7s, okay? So BPA, big factor. Another one is PFO. PFOs are basically chemicals that they put on your non-stick pans. How many of you guys use non-stick pans? I'm sure most people watching. That non-stick, when it starts to become sticky again, where do you think that non-stick went? In your tummy. And all that non-stick chemical is doing is it's, again, another thing called an endocrine disruptor. If you want more information on endocrine disruptors, go to ewg.org, and that's going to give you a ton of information. Karen says, not anymore. Good for you, Karen. Getting rid of nonstick is a big deal for most people, but do it. Okay, third thing, your skincare products, okay? We call them parabens or phthalates. So most women put on several chemicals before they leave the house, whether it's your base and your makeup and your sunscreen and your lotions and your perfumes, your hair care products. If you're putting a ton of chemicals on your skin, it's the largest absorptive surface that you have. All those chemicals are going into your system and maybe linking to the protein and the receptors in your cells that make your insulin less effective and making the cells that receive insulin not receive the signal. So try to look at another website. It's called skindeep.org. It's one of my favorite websites. Put in your skincare product. It'll tell you if it's a grade A or an F in terms of how many chemicals it has in it. Okay, so that's skindeep.org. Look at your skincare products, your makeup, your hair products, your perfumes, anything that you're putting on your skin. So phthalates are really important. Heavy metals. I know we talk a lot about heavy metals in the water system. That plays a big role. Arsenic and diabetes have been strongly connected. So heavy metals can definitely impair the mitochondrial function of the cell. It can impair the cell signaling, the receptors. Anywhere from the synthesis of insulin to then the excretion of insulin can be impaired with heavy metals as well. So our environment plays a huge role in creating this rise in diabetes. So I don't usually try to shame the patient in terms of how much they're eating. I try to work on removing some of the toxins from their diet and some from their environment so that we can have their cells work properly. So if that makes sense, guys, just give me a like or a heart so I know that I'm making sense. And if I'm not, please ask questions. Okay, so toxins. So we talked a lot about what you eat and what might be in your food source. Okay, the last thing on the toxin part is POPs, P-O-P-S. These chemicals are pollutants that are in our soil, in our groundwater, in our plants, and the animals that we eat. So POPs get into our system through the food chain. So know where your food comes from. You say to me, okay, what can I do to get rid of chemicals? I'm going to give you some simple solutions. First, buy organic when it's necessary, okay? We talked about the dirty dozen in the past. Try to look at your foods, your fruits and vegetables. Buy organic if it's on the dirty dozen list. If it's on the clean 15, maybe you can go with commercial. But try to buy clean food. Also, animal products. Try to figure out where your animals are from. What are they eating? And if they're eating something that's toxic, it's getting into your system, so cut that out. We talked about plastic. Get rid of plastic. It shouldn't be in your kitchen. Use glass, use ceramic, use stainless steel, use iron pots. We talked about makeup. Look at your skincare products and remove anything that you know has a lot of toxic chemicals. Go to that website, skindeep.org, and remove stuff that you don't need to apply to your skin. Okay, so those are the top things with toxins. What's the next thing? Food. What you put into your mouth is what your body receives as signals, right? Food is not food, it's actually signals. It's actually chemical signals that tell the body to do good things or tell the body to do bad things. So it goes without saying that if you eat a lot of food that is highly processed refined sugar, you're eating a lot of things that have chemicals, dyes, artificial sweeteners, have a lot of gross things in them, they're not prepared, they're empty calories, these are going to send abnormal signals. Remember we talked about signals that are going to change the clicker and change the garage door. It's going to change your insulin production and it's going to change the receipt of that insulin. That's why you don't want that in your system. So pick whole foods, plant-based foods. I know you've heard me say it before. Studies actually show, multiple studies, guys, show that a Mediterranean plant-based diet has a profound impact on lowering your blood sugar, helping your insulin sensitivity, and reversing diabetes. If you don't know what a Mediterranean diet is, I did a video on that too, but here's the gist. 7 to 10 vegetables a day, 1 to 2 pieces of fruit, seeds and nuts, whole grain products, okay? Fish maybe a couple of times a week. Limit the amount of eggs, yogurt, chicken, poultry, dairy, and then try to minimize or reduce any consumption of red meat. I know that's difficult, so start where you are and keep working towards more plants. That's going to help you, again, change the signaling to your receptors so that your garage door opener works, so your insulin and cell receptor meet and open the cell so that sugar can go in, okay? So eating the right foods really makes a difference. Mediterranean diet makes a difference. There are some foods that I think are kind of interesting that have been shown to help lower your blood sugar. So I'm going to go over those really quickly. Apple cider vinegar. People say, what do you think about apple cider vinegar? I get that question all the time. Well, there are a couple of good studies that support apple cider vinegar. One showed that if you take a tablespoon at bedtime, it helps lower your fasting blood sugar. Another better study showed that when you did 2 tablespoons with your largest carbohydrate meal, it helped lower your postprandial blood sugar. So have it in like a salad dressing or mix it in with water and make it like a tea. And then try that and see what your blood sugars are doing after you consume the apple cider vinegar. That's kind of a neat little trick that I thought was harmless and can help. The next food group was blueberries and bilberry. Bilberry is basically European blueberries. There were studies to actually show that not only is fruit good for you anyway, but it actually had a sugar lowering effect. So eating a little bit of blueberry every day might actually help potentiate your insulin and make your blood sugars lower. Okay, so fiber, barley. All right, this was kind of an interesting study. They took these Chinese men, put them on a boat, had them do meditation and diet and all this kind of stuff. The only difference that they did was half the group ate barley. It has an effect like metformin, which is a diabetes medicine. And that group of men actually had lower blood sugars and lower A1Cs. So if you're craving some kind of carbohydrate, boil some barley and have it on the side instead of white rice and see what that does for you. Because it actually does work like metformin to keep sugar from getting dumped into the bloodstream from the liver. So I like barley as a grain choice as well, just for diabetics. Okay. There are some Ayurvedic or Indian foods that can help lower your blood sugar. So I'm going to go through those two. First is bitter melon. I did a post on that. It's basically a spiny cucumber, but it tastes really bitter. The juice of the bitter melon works like insulin in the body, so it can help lower your blood sugar. So a lot of Indian dishes does include bitter melon in it. Another Indian vegetable, or any vegetable really, is an ivy gourd. We call it dudhi, or we call it lauki. That also has benefits in lowering your blood sugar. Another vegetable that is used in Indian cooking is fenugreek. We call it methi, and that has some sugar-lowering effects as well. So if you're a food connoisseur and you want to add these kinds of foods into your diet, please do. We know cinnamon can help, so add cinnamon into your diet as a spice. Traditional Chinese medicine, they use berberine and astragalus to help lower their sugars. And they also add green tea to their diet to help with weight loss and to help lower blood sugars and to help with overall good antioxidants and help with heart disease. So add that green tea in there too. So there are a few things. Aloe vera juice has also been studied to help lower blood sugars. You can add that in if you like it and you have some heartburn. It might do both things. If you're constipated, aloe vera juice can help with lower your blood sugar and help you with constipation. So that's a good one to add in as well. Okay, so I'm just going to check, make sure I've covered everything. There is a amazing remedy that Mexican Americans and Southwest residents sometimes use. The prickly pear cactus, which has these spiny leaves called the Nopal leaves, have also been used in cultures to help lower blood sugar, either through canning or pickling or sauteing and adding to eggs. So Nopal leaves are another really great food item that can help you control your blood sugar. Okay, so people will ask me, are there any supplements that you take or recommend to help lower your blood sugar? And typically I don't like supplements, but if you check your vitamin D levels or zinc levels or chromium levels or B12, because you're on metformin and metformin can affect your B12, or omega-3 levels, or you have neuropathy and you want to try alpha-lipoic acid, or you have heart disease and you want to add in CoQ10. These are some things that I would check with your doctor before you take any supplements to make sure that they don't interfere with what you're taking already and that they're necessary by doing the appropriate blood testing. Okay, so that's supplements. So that's nutrition and toxins. The next thing is exercise. Of course you knew that I was going to throw that in there, because when is exercise not effective? So there's plenty of tests that show that exercise increases the muscle's uptake of sugar. So this toxic sugar that's causing all this damage in the system, oxidative stress and damaging cells and causing inflammation, you can actually increase the absorption of the sugar from your bloodstream by exercise. But without removal of toxins and without nutritional changes, exercise by itself isn't going to cut it. Often I'll get a diabetic who comes in who has a poor diet but says they make it to the gym every day. That's great, but you really need to do the other parts because those are more important. Though exercise can help facilitate the uptake of sugar and help you with endurance and help you with your blood pressure and your stress, it has to be in conjunction with diet. So high interval exercise training was measured with diabetics, found to be very effective. weightlifting in diabetics, again, because of the muscle use, was very effective. So if you're thinking what kind of exercise should I be doing, mix it up with some cardio, mix it up with some weight training. If you don't have any time, I typically recommend to my patients the 7-minute workout. It's a free app you can download on your phone. It's 7 minutes, guys. It's high intensity interval training, and it's a great place to start. If not, wear a pedometer and start where you are. Check your steps if you're competitive. Compete with friends, compete with coworkers, and try to increase your, or just compete with yourself and increase your steps every day. Exercise. Sleep. Why is sleep important to diabetics? It's hugely important because hormonal control happens at night. So when you're not sleeping, your cortisol levels are elevated, which is a stress hormone, which basically has a direct impact on insulin, has a direct impact on your sugars. And if you don't believe me, if you have morning sugars that are high, but nighttime sugars before bed are low, the reason why it goes up is because of cortisol and stress and hormone dysregulation. So getting a good 6 to 7, 8 hours of sleep is really important. The other thing that happens is when you don't sleep, you actually lower a hormone called leptin, which is your stop eating hormone, and you increase ghrelin, which is get hungry hormone. So a lot of my diabetic patients are hungry a lot, and it has a lot to do with this ghrelin hormone that is elevated when you don't sleep well. So sleep regulates insulin, sleep helps lower cortisol, sleep also helps balance that leptin and ghrelin levels to make your appetite more appropriate. So sleep is important. The last thing I'm going to hit is stress reduction, and I always talk about stress reduction because I think the mind has a lot to do with health. Study after study after study shows that diabetics are more prone to depression and have a lot and report a lot more stress. So addressing stress is a big component of fixing and preventing diabetes. So you can use any method. You can use meditation, you can use biofeedback, hypnosis, guided imagery. If you like massage therapy, if you like pet therapy, music therapy, incorporate something in your life that helps lower your stress levels, because that in itself is also one of the reasons why your diabetes may be out of control or why you're prone to having diabetes, the toxic mind, okay? We talked about toxins in the environment, toxins in your food, and toxins in your mind. So before we end this morning, I'm going to walk you through a mindful eating exercise. So when you are consuming your food, it's really important to pay attention, stay in the moment, appreciate the food that's in front of you. So the exercise I'm going to take you through is called the chocolate exercise. Okay, so my favorite part of the talk. So here's a little piece of dark chocolate. So to get started with any food that you have in front of you, use all your senses to stay present in the moment. So place your chocolate, or whatever it is, raisin, cashew, in the palm of your hand. Look at it. Look at the shape. Look at the size. Look at the color. Smell it. That does smell good. Appreciate the weight. Appreciate the melting in your hand. Now, I'm not going to put it in my mouth, else I won't be able to talk. But what you want to do next is put it on your tongue. Let it sit there. Allow the weight of the chocolate to sink on your tongue. Appreciate the smell. Appreciate the taste and the weight. Then slowly roll that chocolate around. Listen to it moving across your mouth. The taste, the smell, the texture, as it slowly dissolves down the back of the throat. And appreciate again the piece of chocolate that is melting down the back of your throat, the taste, the feel. And then take a deep breath in between and stay in the present moment with your experience. So mindfulness is a very common thing now. We talk about it a lot, but the basic premise of it is staying present to this moment without judgment. And when we do that with food, we receive the chemical messages from the food in a positive way, which then triggers and signals our cells to receive that information in a positive way. All of that then translates to a positive experience, and it improves health. So I'm a big fan of adding mind-body exercises to nutrition, to watching chemicals in our diet, to exercise, to sleep, and using this method. Share with your friends and family. Share this video if you thought it was helpful. Let me know if you have any further questions about any of the things that I've mentioned this morning. My intention is just to educate. Hopefully I've done that this morning and you've learned something new and then can translate that. Remember, it's not about the car, it's about the garage door opener and the garage door, and what's breaking it down, what's breaking down the signal is all the toxins in our system. So start working there. Clean out your closet and your pantries, get rid of the foods that don't nourish you, go make a shopping list, look at Mediterranean diet recipes and pull some foods that you might be willing to try. Start exercising wherever you are, work on your sleep hygiene, and then mostly I'd say work on your mind and your relaxation and your stress. Okay, so thank you for joining me this morning. Have a great morning. For those of you that are local, I'm heading over to the community garden, so I'll see you there. Okay, bye-bye.